you can remember, you can remember all our CV, and very good, well done. And I must thank Jeffrey Koo. He invited me months ago. He said, you must come and talk to us about depression. I said, sure, it's one of my favorite topics. Okay, let's press on. Sadness is not depression. Sadness is a feeling we have now and then, but it's not depression. So we can say I'm sad, but it doesn't mean you are depressed. I remember a story when I was in the SAF. There was a major, he committed a stupid offense when he was depressed. So two colonel came to me, hey, we are going to see General Winston Chu, Chief of Defence Force. You please come along, provide support fire, just in case General Chu wanted to know about the case. So two colonels sitting in front of General Chu, and General Chu was telling them about, I know this major, he was my man, he was very good, very competent. Now what happened to him? So the two colonels, when General Chu was speaking, keep lowering their head. Don't know what to say, because General Chu was disturbed that his men can develop to such a state. So I was at the corner and I said, sir, allow me to say something. Yes, Doc, what would you want to say? I said, this major was depressed and he did what he did. I'm also depressed. I said, sir, you're not depressed, you're sad. I said, there's a difference between depression and sadness. So, what's the difference? So I said, sir, I told him the difference. Then he told the two colonels, you go back and rewrite what Dr. Ang just said. And we will fight for this major because he was depressed. He shouldn't be taken to task for his offense. So remember, you can be sad, but not depressed. The next word is depression. A lot of us use this word, I'm depressed. Overused this word. Just like, I'm stressed. I think stress is everywhere. Everybody is stressed. So, it's a 6-letter word, but sometimes it sounds like a 4-letter word. I'm stressed. Stress is a fact of life, but don't make it a way of life. Conquer stress before it conquers you. So a more useful term is clinical depression. Clinical depression. In other words, you're clinically depressed. And what are the features of clinical depression? And that's what you are here for, to understand what is clinical depression and what you can do to overcome clinical depression. You see, these are various terms people use for sadness. I feel low, I feel down, I feel blue, I feel moody. And there's another word called grief. Grief, again, is not a mental illness. Grief is normal. Grief becomes abnormal when it's pathological and prolonged. Pathological and prolonged, that means lasts for years. You can't come to terms with the loss. And then it is pathological. I remember one lady lost her son due to a traffic accident. It was a sudden death. She couldn't take it. She preserved the son's bedroom. She preserved all the items in that bedroom. And whenever she cooked the son's favorite dish, she would have an empty chair, invite the son to eat. Mom, cook your favorite dish. Son, come and eat the laksa. That is pathological grief. Not 1 year, not 2 years, but 3 years later, still doing the same. This is called mummification. Everything is preserved, like a mummy, mummified. And what is more worrisome is that she would take some of the clothing and throw into the laundry bag. And then she will wash the clothes, dry the clothes, take back the clothes, put back in the wardrobe. And then whenever she goes out of the house, son, mommy is going out. And when she comes, son, mommy is back. And that is called pathological prolonged grief. And that is different from normal grief. Now, the trouble with depression is many may have it without knowing. So, cases go unrecognized. I have my 5 S's of depression. Okay, let's see. How do we click thing? The video. Come, Chris, help me. Sad, slowing down, self-blame, suicidal thoughts, and somatic complaints. Hi, today I'm talking about depression. Depression is about low energy level. In depression, there are 5 clusters of symptoms. Starts with S. Sad mood, low mood, slowing down. Everything slows down and is sluggish. Your movement, your speech, you don't feel like doing anything. Your activities are all halted. Third S is self-blame, negative thoughts, and guilt feelings. Fourth S is somatic complaint, bodily complaint, loss of concentration, loss of appetite, loss of sleep, and even loss of libido. The last S is suicidal thoughts and attempts. Thank you. Of the 5 S's, if you have all 5, full house, psychiatric emergency. And if you have the last one, suicidal thoughts, it's also psychiatric emergency. Okay? I will cover a bit of suicidal thoughts later. And Charlene is here, Miss Haywood from SOS will talk more about suicide and attempted suicide. Now, we call clinical depression DSM-5 text revision. This is the American Psychiatric Bible. Most psychiatrists use DSM-5. And it says that there are 9 criteria. If you tick 5 out of 9, you are having MDD, major depressive disorder. To me, it's clinical depression, okay? And you can have mild, moderate, or severe. Now, depression coexists a lot with anxiety. One side is anxiety, the other side is depression. They often coexist. What is anxiety? What is the difference between anxiety and depression? Depression is no energy, lack of vitality. Anxiety is tension. It's like a rubber band being pulled. So when you're anxious, you're tense. The whole body is tense. So you feel like vomiting, you have tightness of chest, you have shoulder ache, you have tremors, you have giddiness, you have headache, you can't walk properly, and that's anxiety. Okay? Depression will be #1 cause of disease burden by 2030, and is one of the 4 causes of burden of disease in Singapore today. There are 4 causes. They call it disease burden. Depression is one of the 4. This is MOH findings. Now let's listen to Andrew Solomon, how he described his depression.
In 1991, I had a series of losses. My mother died, a relationship I'd been in ended, I moved back to the United States from some years abroad, and I got through all of those experiences intact. But in 1994, 3 years later, I found myself losing interest in almost everything. I didn't want to do any of the things I had previously wanted to do, and I didn't know why. The opposite of depression is not happiness, but vitality. And it was vitality that seemed to seep away from me in that moment. Everything there was to do seemed like too much work. And so I began to feel myself doing less, and thinking less, and feeling less. It was at that point that I began to think that it was just too painful to be alive, and that the only reason not to kill oneself was so as not to hurt other people. And finally one day, I woke up and I thought perhaps I had a stroke, because I lay in bed completely frozen, looking at the telephone, thinking something is wrong and I should call for help. And I couldn't reach out my arm and pick up the phone and dial. And finally, after 4 full hours of my lying and staring at it, the phone rang, and somehow I managed to pick it up. And it was my father. And I said, I'm in serious trouble. we need to do something. The next day, I started with the medications and the therapy.
Medication and therapy, N and N. Therapy is other methods. We'll come to that later. Winston Churchill had bouts of depression, and he even called it black dog. He would tell his doctor, the black dog is attacking me now. He would go to the balcony, he would rock on his rocking chair and rest for a few hours. And this is what we call endogenous depression. That means biologically inclined, born to have chemical imbalance, biological depression or endogenous depression. Our fourth president developed what we call a reactive depression. He wrote about it in his book. In 1937, the Straits Times watched over the Malayan Times in Ipoh. He was tasked by the Straits Times to go to Ipoh to reorganize the branch. Before he arrived, there was a rumor. Mr. Wee is coming here to sack old employees and employ new ones. Nobody cooperated with him. He worked 16 hours a day. By the time he went back to his hotel room, he was exhausted, tired, he couldn't sleep. And he couldn't eat. You see? There was loss of weight, and his mind was full of negative thoughts. He went to see his company doctor, Dr. Kong. Dr. Kong said, "Young man, you are homesick. You either go home today or you'll be in trouble." Mr. Wee said, "If I don't go home today and rest, what will happen? You will either die or go mad." Wow, very frank doctor. Very direct. Wow, I tell you, nowadays doctor will give you 1 week of Panadol, 1 week of MC, come back in 1 week's time, right? This doctor was very blunt. Mr. Wee took the train, came back to Singapore, rested for 3 months, recovered, went back, later on became Singapore's ambassador to KL, and went on to be the 4th president of Singapore. I always tell this story because this is a success story. And this 1937, the company culture was so enlightened at that time. They did not mark him. They did not say, "Oh, you couldn't take stress. Oh, you're not resilient. Oh, we want to remove you." They actually went along. They allow him to rest, and they send him back to Ipoh again. Enlightened company culture. And I mentioned this company culture play a big part. Some of my patients who come to see me, they work in a toxic environment. If not for the toxic environment, they won't be depressed. So that is what we meant by reactive depression. By the way, one day I met him, Mr. Wee, and he was telling me, "Dr. Ang, I am very worried about the country. We are achieving so much, but we are paying a high price. Are we a happy nation? We are all struggling, coping with stress. We are very successful, but at what cost are we paying?" So in this book, there's a whole chapter about dealing with stress. Stephanie Sun's depression. I saw this on board SQ flight. I was looking at the documentary. Stephanie Sun got depression. I quickly snap picture. Snap picture. Did you feel that you had depression at that time? Yes, but I didn't see any doctor. Afterwards, I'll tell you how she treated her depression without seeing a doctor. The reason why depression is important because of risk of suicide. Anthony Bourdain, Kate Spade. You have Avicii. Avicii is a Swedish DJ. His video 1 billion views. 1 billion views. He took his own life at 27. Avicii. And then you have pastor's son, Rick Warren, Matthew Warren, but son of Rick Warren, who wrote the book Purpose Driven Life. That book sold 10 million copies. His son took his own life at the age of 27. So it's very sad. And Coco Lee, last year took her own life at the age of 48. Miss Heng will elaborate this whole topic of suicide later. Leslie Chung, look at Leslie Chung. Suicide note, look at the first word, depression. Leslie knew that he was depressed. So sad. Oriental Hotel, jump. Okay? The year before, 2022, 476 Singaporeans took their life. More men than women. And this age group is very worrisome, 20 to 29. Very worrisome age group. Just now, someone was telling me, age 25, a youth pastor, only child, took his own life last year. So this group is very worrisome. What's wrong? What's wrong? What is the issue with them? Miss Heng will throw a lot of light later. Causes of depression, you have biological, you have psychological. Psychological personality play a part. Negative life events and traumatic experiences. Okay, I urge all of you from today onwards, score your mood from 0 to 10. Now I am 7 upon 10. Just now 6 upon 10. So we score our mood after supper later on 9 upon 10. Okay, so make sure it doesn't drop below 5. 0 to 10. Now, every patient we see for depression, we make sure they don't have moments of mania. Mania means 11 upon 10. They think they are. Got one, Andy Dung, you go YouTube, he thinks it's Jesus Christ version 2, you know. They are very euphoric and elated. And that is bipolar disorder, bipolar depression, which is a separate topic. Today we're just concentrating on unipolar depression. Severity, mild, moderate, and severe. Now, this is a very severe depression, so severe that we call it psychotic depression. They hear voices, they talk nonsense, they have paranoid beliefs, they are deluded, hallucinated, and they have loss of touch with reality. And the acronym is very simple, DHL. DHL. So when you have DHL, psychotic depression. DHL. Okay? Now, I have no time. Sally has got psychotic depression. I won't show you the video, I'll cut it out. But she heard voices, she saw images, and she received ECT. You'll come to know about ECT later. ECT is a treatment of choice for psychotic depression.
I've been psychotically depressed once, and it was the worst experience of my life. And in the depths of that depression, I experienced
Visual hallucination.
And I was also paranoid. I thought people wanted to do experiments on me, and saw some figures, visual hallucinations.
So ECT helped her. Now, biological factors. There are two facts about the brain I want to share with you. Fact number one, we all have an emotional brain called the limbic system in the middle of the brain. All of you raise up your right fist. This, and then pull it next to your right ear. This fist represents the limbic system right in the middle of your brain. All of you raise your left hand and put it over your right fist. Put it in front, put over the right fist. Right. And this represents your cerebral cortex. The first forefinger is your prefrontal cortex. If your limbic system is connected to your PFC, you don't have problem. It's only when it's disconnected, the risk of depression is there. The risk of anxiety, the risk of mental problem is there. So fact number one, we want to connect our emotional brain, the limbic system, to our PFC, prefrontal cortex. And the prefrontal cortex is responsible for what? Thinking, planning, prioritizing, thinking, controlling of impulse, thinking of consequences. Now, fact number two is we all have a left lobe and a right lobe, left hemisphere and a right hemisphere. When there's an imbalance between the two, we're in trouble. Let me say a bit about the left. The left is for logic. You all know that, logic. The right is for creativity. We know that. But this man has done so much work on the left and the right brain. He's a retired psychiatrist, 70 plus, in Scotland. And he has done 20 years of work on the left and the right brain, And he's telling the world, look, the divided brain and the impact and the making of the Western world. Ian McGilchrist's main point is, we are living in a left brain world. We are living in a left brain world. What is the left brain? Left brain is about, it's about rules, regulation, procedure, guideline, black and white, right and wrong, good and bad, binary, 0 or 1. The left brain is artificial intelligence. It is your logic, 1 or 0, binary. Very, very dangerous if you only use your left brain. If you overuse your left brain, you can have what we call what logic. Your logic becomes very what, right? So, and we are living in a left brain world. Show me your result. Do well. What house you live in? What car you drive? Your girlfriend, what is she studying? Where is she studying? We are all obsessed with left brain activities. Please combine it or balance it with the right brain. And the right brain is about creativity, about intuition, feeling for someone. It is about values of life, compassion, kindness, empathy, altruism. The right brain values you can't see. It is not about material things. So let's balance the left and the right. When you balance the left and the right, you have quality of life. You have a well-balanced life. You learn to appreciate beauty. Because the right brain is about going to walk in the garden, going to church, going to temple, going to mosque, worshipping God. The right brain is spirituality. Play with your dogs, play with your cats. That is the right brain. The left brain says, waste time. He play with the cat, he waste time. Vet's so expensive. Bring to see the vet $500. Waste money. The dog cannot talk to you. That is the left brain talking. If left brain, why waste time on such values, such things which cannot be measured? Look at Matthew Warren. Overdeveloped right brain, full of intuition and empathy. A gift for sensing who was most in pain or most uncomfortable in a room. On top of his own depression. Definitely you are in trouble. You walk into a room, this fellow depressed, this fellow anxious, this fellow preoccupied with problem. Full of empathy, full of feeling for people. Therefore, you must have balance between left and right. Okay? Now, I want to show you one very good case, Sammy Cheng. She overused her left brain until burnout. Until burnout. Can we play?
我就是没办法走出我的房间，我就没办法去工作，也没办法走出这门口。到最后一个 minute， 我就打给我经纪人或者是我助理说，我今天病了，我就没办法。但是其实我在家里是忧郁的很严重，我心里面就跟自己讲，我要关灯了，因为我好像一个油灯完全没有了。
Burn out, overuse the left brain, perform. Do work, sing, dance, movie, one contract after another, money. But where is the quality of life? The 3 years make her reflect. I am very selfish, I'm a very easily angered person, My values are all wrong, I chase after fame, success, and beauty, 漂漂亮亮就好。一个礼拜2粒苹果。晕倒没关系 faint, never mind. Beauty more important. What kind of values is that? Putting beauty above health. Let's play the last video clip.
追求完美当中也让我常常听不到自己心灵上面的需要。我以为成就，我以为金钱，我以为漂漂亮亮就是一切就足够了。我拥有这些，这个就等同郑秀文了。说。我根本不理我自己身体，我减肥7天吃2个苹果，7天只吃2个，对，完全不理身体，我昏倒了。 没关系，最重要漂亮，最重要瘦，让我问到没关系，我就把一些很错误的价值观一直堆放在自己的身上面，追求完美当中也让我常常。
During the 3 years, she focused on her right brain. She started drawing. She started writing a book. At the end of the 3 years, she published a book. She related to her family relationship, attends church. The sister brought her to church. And developing the right brain to balance the left brain. Now you have a very simple example of how Sammy Ching used her right brain to balance the left. Okay? Now you see, I was very insecure. I was chasing after fame and success. Religion changed my values. I am more relaxed now. Okay? And okay, play this one, just a bit short one.
Hi Asia One, I'm Sunny Chang. I'm so honored to be here to promote a new movie.
我当初重新出发，就是我觉得我不能够再沉沦下去，不能够在这个 depression 的 mode 里面，然后我就确定要掏出来再开个演唱会。当我跌到一个谷底，或者已经好像一个半死的状态，我又重新爬起来，然后又看到不一样的那个风光。我好喜欢不停去用不同的角度去看自己，然后也不 set 任何的 boundaries 给我自己。我觉得任何年龄都可以有这个力量，可以发现一个不一样的自己，觉得特别的自然，因为那个也是我的一个部分，不管他是美丑肥瘦，都是我整个人的一个部分。
What happened? When you activate your right brain, you open up your mind. Aiyo, how stupid was I? 1 week only 2 apples. Now open her mind. It's called balancing the left and the right. Before that, it was a closed mind. Money, money, money. Fame, fame, fame. Acting, acting, acting. Okay? This is called opening of the mind. And only balancing the right and the left can open the mind. I told Andrew I may take more than 20 minutes. Andrew said, yeah, go ahead. So I've got another few more minutes left.
Hi Asia.
Okay, so I want to share with you personality and depression. Personality and depression. Personality. What kind of person are vulnerable to depression? People who overthink. People who are perfectionistic. Sammy Ching said, 追求完美, perfectionist. People who are worrier, chronic worrier, non-stop, 24/7 worry. Right? And people who are very insecure, emotionally very insecure, very easy to get depression. Okay? This girl was treated at NUH for 9 months for depression. The church pastor called me, hey, Yong Guan, I think it's not just depression, 9 months still hasn't recovered. JC1, top junior college, 9 months depressed, in and out of the hospital. I went to the church office, I saw her. After 1 hour, I told her, Mary, it's not just depression. You have a personality problem. Insecure, perfectionistic. She cut her wrist. When she sees negative things, she will just cut her wrist. When she feels negative, she'll cut her wrist. I say, you need to get a psychiatrist to take care of her personality. She called her pastor the next day. I want to see Dr. Ang. So she saw me for another 3 months. So together 1 whole year, she couldn't go to school, JC1. In 3 months, we got her well. She went back to school and then graduated as a professional. I don't tell you what profession, otherwise you say, Dr. Ang, this patient I know this patient. Not fair to the patient. She recovered and she missed her first class honors by 0.06. The old Mary would cut herself. The old Mary would focus on the 0.06. Stupid idiot, can't even get 0.06 more. You're good for nothing. You're good for nothing. Because perfectionists are either 100 or 0. And needs first class honors. First class honors, you need to have 4.45. She got only 4.44. Then she consoled herself. Second upper is good enough. This could be rationalization, consoling herself. Until I saw the next point. My self-esteem has nothing to do with my academic achievement. If I do well, it's a bonus. If I don't do well, I'm still married. I still have self-worth, self-identity, and self-image. That is the meaning of self-esteem. The greatest gift we can give to our children is self-esteem, not self-confidence. With self-esteem, they can build self-confidence. With self-esteem, they can conquer the world. And self-esteem is inside you. Your image, your identity, and your worth. So parents here, build self-esteem in your children, not self-confidence. With self-esteem, self-confidence will come. I've seen too many examples. Outwardly very confident, can sing, can dance, big time CEO, no? But inside a low self-esteem. A little criticism, the whole night they cannot sleep. A little comment, they ruminate the whole day. That is low self-esteem. Very successful CEO. No? Sammy Cheng is one classic example. Successful actress, but insecure. Right? This is the opposite. The doctor blamed his personality, failed to treat the depression. This is the flip side of it. Not your depression, your personality. I think it's wrong as well. We need to treat both, the depression and the personality. Just like Mary, we don't want you just, it's your personality, not depression. He committed suicide. In the suicide note, he said, the doctor failed to pick up my depression. Okay? Now, coming to an end, this is my consultation room. In my consultation room, I had rows and rows of medication. The first M. The first M is medication. The second M is methods. What other methods other than medicine that I can help the patient? Yoga, exercise, counseling, psychotherapy, religion, hobbies. So we use antidepressant for people who are depressed for a short period of time, make sure they can recover from their low mood. Sometimes we add anxiety, because I told you anxiety coexists with depression. Then sometimes we use hypnotic. If the patient cannot sleep, we use hypnotic. And sometimes we use antipsychotic if they have psychotic depression. We add antipsychotic. But first M only, don't forget there's a second M. First M also include procedure like ECT. Kitty Dukakis, wife of presidential candidate, Michael Dukakis, was depressed for 18 years but undiagnosed. Every night she would take 4 or 5 glasses of red wine. The 4 or 5 glasses of red wine is her medication. Help her to sleep, help her to lift up her mood. And she responded to ECT. Okay, let's click and see. She responded to ECT.
Was so desperate at that point that any recommendation, any suggestion was something that I would have accepted.
When I first saw Kitty, I thought that she was an excellent candidate for ECT. She had classical symptoms of depression, and her illnesses had been only partially responsive to antidepressant therapy.
Johnny Walsh obviously has been Kitty's doctor and strongly suggested that if she had another depressive cycle, chances were that she would, that we ought to seriously consider it.
Yeah. This doctor, this is a surgeon, had 20 ECT. It's a record. ECT normally is 6 to 12. Let's click and see.
So they gave a course of 10, and the usual course incidentally was 6 to 8. Plugged me into the wires, put me to sleep, gave me the muscle relaxant. 6 didn't work, 7 didn't work, 8 didn't work. At 9, I noticed a change, and at 10, I noticed a real change. And he went back to them, and they agreed to do another 10. They did, lo and behold, by 16, by 17, there were demonstrable differences in the way I felt. By 18 and 19, I was sleeping through the night, and by 20, I had the sense, I really had the sense that I could overcome this, that I was now strong enough that by an act of will, I could blow the obsessional thinking away. I could blow the depression away. Standing in the kitchen by myself and thinking, I've got the strength now to do this. It was as though those tightly coiled wires in my head had been disconnected, and I could think clearly.
He was fortunate to have a psychiatrist who dared to think out of the box. Give 20, maximum is 12, 6 to 12. If medical counsel were to find out, wow, you give 20, you're in trouble, cancel your license, suspend you for 1 year. So we need courageous doctor. Make sure you do the right thing. You do the wrong thing, sorry to you. Okay. So other methods, exercise, yoga, sports, hobbies, meditation, very important. Meditate. You clear your mind every day. You meditate. Counseling, psychotherapy. Psychotherapy is a more formal way of going deeper into your life, exploring your childhood, exploring your growing up, exploring your mental block, relationship building, and religion. Don't forget religion. Very vital. Where we all fail, God succeeds. There you are, Stephanie's son. I gave myself time and space. I had people who cared for me. No need to see psychiatrists, especially if it's mild depression. See a good friend. Talk to your parents, talk to your siblings. If they are not close to you, talk to a close friend. Avoid seeing me, please. I'm the last resort. When everything fails, you come to me. Everything succeeds, ignore me, okay? Okay, so basically you need to use two skills to swing up mindfulness, to swing up. Because I told you, you need to connect your emotional brain to your rational brain. And mentalization to swing right. What is mentalization? Mentalization is being mindful of other mind, mindful of others' mind, other people, like empathy. Mindfulness is mindful of your own, connecting your emotional and your rational brain. Mentalization is mindful of other mind. And this is very well explained by Professor Bateman, practicing mentalization. Let's listen to this.
And that's what the mentalizing process is understanding both ourselves, what's going on in our minds, what might make us do things, and actually when we're with someone else, what makes them, what's going on in their mind that makes them behave or ask the questions they're asking.
Mentalizing is the ability to mind other minds. It's to understand misunderstandings and to see oneself from the outside and others from the inside.
So to succeed, you want to connect your emotional brain and your rational brain, practice mindfulness. You want to activate your right brain. Right brain is about others, caring about others, altruism, compassion, kindness. It's all about the right brain. You practice mentalization. Both, whether it's mindfulness or mentalization, it involves opening of the mind. Open up your 5 finger. When your mind is closed, you're in trouble. You cannot connect. When your mind is closed, you clash. 2 closed minds clash. One open, one closed also clash. So you need both to be open, to be connected. And the acronym is orientation, O-P-E-N. Every morning you wake up is a choice. You want to think positively or you want to think negatively. And don't need to go far away. God has given you a big thumb, which is positive, thumbs up. God also has given you a little finger, which is lust. A lot of people close our minds, see nothing, or only see the little finger. And the whole day, BCC, Bin Chao Chao. And Kao Bei Kao Bu. Because they only see the little finger and the mind is closed. You look at my 5 finger now. I open my mind every morning I wake up. Heng I still have some hair. Heng I'm still alive. I can wake up from my sleep. You know, it's orientation. You want to orientate negatively, you are going to be in trouble. Orientate positively, mindful that you are having a little finger. I'm not telling you to have 5 thumbs. God never gave you 5 thumbs. 5 big thumbs. God also give you a little finger. But God wants you to see the little finger in perspective. In perspective. What is P? P is purpose. What is the purpose of coming to this talk? To learn about depression. Maybe you have family members, maybe you have friends who are depressed. You want to have knowledge about depression. Every time you do something, what is the purpose? What is the purpose of me for me to give this talk? I enjoy sharing. I enjoy sharing. The more I share, the happier I am. Alright? Engagement. You can only engage when your mind is open. When your mind is closed, you clash. If your son's mind is closed, your mind is open, please wait for his mind to open before you talk to him. If your mind is closed, someone else try to talk to you, you say, can I wait for another day? I'm not ready to talk. When you're engaging each other, you must have open mind. And then N is nurture. Nurture is 培养, You nurture. But nurture yourself first, self-care. The only 3 things you need to do about self-care. Eat well, eat right, sleep well, 7 to 9 hours, and make sure you breathe. How to breathe? Exercise. Make sure you exercise regularly. And then you can nurture others. Don't forget to nurture yourself. Self-care is very important. When you practice this, when you open your mind, you're mindful. When you open your mind, you're mindful of others. You practice mentalization. So what have all these people in common? Even Lady Gaga went through very difficult period. She was interviewed by Oprah Winfrey. She talked about seeing a psychiatrist, and the psychiatrist gave her antipsychotic because she cut herself. She banged her head against the wall. And what do all these people have in common? Their minds are open. They appreciate, they accept, they adapt. Appreciate, accept, adapt. Appreciate, accept, adapt. The moment you can't appreciate, accept, adapt, your mind is closed. And when your mind is closed, a lot of problems will happen. So take home messages. Clinical depression can be treated, the earlier the detection, the faster the recovery. Acquire 2 skills, mindfulness and mentalization. Tonight, Google mentalization. Lots of video on mentalization. And do a lot of second M. Not relying on medicine. Second M is other methods. From yoga to meditation, to counseling, to hobbies, to religion. So thank you very much for your kind attention. I look forward to your questions.